Ready to dive into some fascinating research. We're taking a closer look at a 2024 study from Veterinary Clinical Pathology about phenobarbital in dogs with epilepsy.
And let me tell you, this one really has us talking.
It definitely throws a wrench into things, especially when it comes to something as fundamental as blood clotting.
We're talking about a potential link between a drug we use all the time and a system that needs to be working flawlessly, especially during surgery.
Right, because the last thing we want is an unexpected complication on the table.
Absolutely. And what makes this study so fascinating is the use of thromboelastography, or TEG, to really dissect the blood clotting process.
PEG seems to be gaining traction in veterinary medicine, but for those who aren't as familiar, can you give us a quick breakdown?
Sure, think of it like this. TEG allows us to visualize the entire clotting cascade, from the initial clot formation to how strong it becomes, and importantly for this research, how quickly it breaks down.
So it's not just about whether a clot forms, but the dynamics of that clot over time.
Exactly, and that breakdown process is called fibrinolysis, which TEG gives us a unique window into.
It paints a much more complete picture than traditional coagulation tests.
You got it. And in this study, they took 24 dogs, some healthy, some on short-term phenobarbital, and others on long-term, and used TEG to analyze their blood clotting.
And that's where things get really interesting, maybe even a little concerning, depending on how you look at it. They've got their TEG readings, they've crunched the numbers, and what's the verdicts? What did they find?
Well, this is where it gets really interesting. Almost half of the dogs on phenobarbital, and we're talking both short-term and long-term use, showed signs of something called hyperfibrinolysis.
Hyperfibrinolysis. Okay, that definitely sounds like a mouthful. What exactly does that mean in plain English? What's happening in the body?
In simple terms, it means their bodies were breaking down blood clots faster than they should.
Okay, so faster clot breakdown, which, I mean, at first glance might not seem like a huge deal, right?
Right. But here's the thing. None of these dogs were showing any obvious signs of bleeding problems. So we have this underlying tendency towards rapid clot breakdown, and it could be going undetected in a lot of cases.
And that's what makes this research so important, right? It's like a heads up that we might be missing something crucial, especially when you think about surgery, any procedure with a bleeding risk.
Absolutely. You have a patient prepped for surgery, everything looks good on their coagulation tests, but this study suggests there might be more to the story than meets the eye.
Makes you wonder how many times we might have seen complications that could be linked back to this, but we're attributing them to something else entirely.
It's definitely something to think about. Now, to be fair, the study itself didn't actually find any bleeding complications in these dogs, but it raises a red flag nonetheless.
Right, it's not about pushing the panic button and clearing phenobarbital off the shelves, but it's about being aware and making informed decisions.
Yeah.
One thing that stood out to me in this study was that they found elevated liver enzymes in some of the dogs on phenobarbital. We know that's a known side effect of the drug, but could there be a bigger picture here?
Yeah, the liver is like the body's Swiss Army knife, involved in so many processes. And of course, blood clotting is right up there on the list. So could the liver be the missing piece of the puzzle here? Could it be the link between phenobarbital and this hyperfibrinolysis we're seeing?
It's definitely a prime suspect, right? The liver is responsible for producing most of those clotting factors we rely on, and on top of that, it's heavily involved in metabolizing phenobarbital.
Hmm.
So if the drug is impacting liver function, which we already know is a possibility, it stands to reason that there could be a domino effect on the clotting cascade.
So it's not a huge leap to think that maybe those phenobarbital-induced liver changes could be what's tipping the scales towards hyperfibrinolysis. Exactly, although, and this is important, the study didn't definitively prove a cause and effect relationship. They observed both elevated liver enzymes and hyperfibrinolysis in these dogs, but more research is needed to say for sure that one is directly causing the other.
Right, it's a correlation at this point, not necessarily causation, but still, it's a pretty big red flag for us as clinicians.
Absolutely, and it highlights the need for more focused research in this area. What happens with different phenobarbital dosages? Does it change things? Are there other clotting factors we should be looking at alongside TEG in these patients? And what about the long-term impact of this accelerated clot breakdown? These are all questions that need answers.
It's like this study cracked open the door to a whole new area of research, and suddenly we're faced with a wave of new questions. It makes you wonder what other subtle effects phenobarbital might be having that we haven't even uncovered yet.
Yeah, it's a bit humbling, isn't it? But it also what keeps things interesting in veterinary medicine. Always learning, always adapting.
Speaking of learning, this study has definitely given us all a lot to think about. For our listeners out there, consider how this might change your approach to managing epileptic dogs on phenobarbital, especially when you're planning a surgery or assessing bleeding risk. Maybe TEG is something to consider more often in these cases. More research is always the answer. But this study gives us a good starting point and gets us asking the right questions.
Couldn't agree more.
And that wraps up our deep dive into the intricate world of phenobarbital, blood clotting, and of course the amazing liver. Thank you for listening to Vet Neurojar, and until next time, keep those minds working and tails wagging.